We're talking with Dr. Nicola Simmerspa, and she's a licensed marriage and family therapist along with a licensed professional clinical counselor. And we're having a conversation about EFT, emotion-focused therapy. Now, Nicola, what is emotion-focused therapy?
Well, I'm so glad to be able to talk about this because this is one of the things that I want to talk to everybody about. If you're in my life, you know that I'm talking about emotion-focused couples therapy. And it's something that has been around for a long time. It's been around and studied for over 20 years, but I just discovered it about 5-6 years ago. And it changed how I work with couples. And the reason I love it is that it works. It really helps couples move from a place of blame and hopelessness and stuck and, oh my God, we're having the same fight again, to learning to decode those underlying, very tender, sensitive, vulnerable messages that they are trying to give to each other and that come out in a way that pushes their partner further away from them, though. And so they get more and more confused because what they really want is closeness and connection. And yet somehow they may not have the tools yet or the skills for how to draw their partner closer and to help them feel connected and safe and secure in their relationship.
How common is this type of therapy today?
Well, I think it's ever growing. What's interesting to me is that emotion-focused couples therapy, or EFT as we call it for short, is used all over the world. It's very popular in Holland and other parts of Europe, and it's extremely popular in Asia, especially China and Japan. So it's a kind of therapy that I think is just blossoming in the U.S. It was developed by Dr. Sue Johnson and her cohort Les Greenberg. And they did a lot of research. I mean, what I love about this therapy is that it's based in research. It's not just a theory, and it's been replicated many, many times. So all of these studies over all of these years have been done on couples all around the world and on all different kinds of couples. There's heterosexual couples, same-sex couples, couples who've experienced trauma, couples where there's substance abuse, couples dealing with cancers, couples dealing with issues of infertility. I mean, you name it. Emotion-focused couples therapy can be helpful. And there's a lot of research studies. One of them, the main thing that we're seeing is that about 70 to 75% of couples go from a distressed state to recovery. And that's a very, very high percentage. Couples therapy does not have great outcomes, but for emotion-focused couples therapy, it really stands out above all the others. And that's something that's very, very effective. It also shows that about 90% of people who go into emotion-focused couples therapy show improvement, and that's even if they don't finish it. There are 9 steps, and there's 3 phases, and it's a very planned out kind of couples therapy. But even if you have to break off because you move out of town or because something happens in your life, couples still show a significant improvement even if they don't finish it.
It seems like a phenomenal success rate when you compare it to other forms of therapy sometimes. So what kind of training does it take a therapist to get a certification in EFT?
Oh, that's a really long process, and it's something that I've undertaken very gladly because every time I go, it's so inspiring to go to these trainings and watch some of the masters demonstrate how to help people get from some of these very painful places settle down and calm down. So there are years and years of training that go into it. There is something called an externship, which is a week-long training. Then there's core skills, which is many weekend trainings. Then you have to do individualized supervision, and even if you finish that, there's still more to do after that. So it's I would say that EFT is a lifestyle. It's really something that you invest yourself into, and but if you do, it's extremely rewarding. But I want to tell you a little bit about what EFT is based in, because that's what's so important. That's what makes this so different. We know that individuals, humans, we're basically pack animals. We belong together, we seek connection, and that when we push a person away, when we ostracize someone or shun them like they used to do in the old days, punishment was shunning, The effect of that on the human brain it registers pain the same way as if someone were to receive a physical assault. Mm-hmm. So needing to have connection is very, very important. And when you're a child, we sort of take for granted that, of course, you're connected to your parents or your caregivers or whoever, the adults that you're close to that help you feel safe. But what happens when we grow up? There's always been sort of this theory that, well, when you grow up, you didn't need anything. You didn't need anybody. And we now know that there's hard science evidence that we actually do need the support and the connection of other people. And certainly a couple's relationship is not the only one. You can have a tremendously close relationship with a very good friend, a therapist, a religious leader, a sibling, and for some people, even a connection with God or a spiritual connection helps them feel that same level of security. But for the most of us, it's that romantic partner. That's the person that we connect to, and that's where we really need to get those needs met from. And when we don't get them, because we get stuck in these patterns that don't work very well, we do one of two things. And typically, there's people who notice that my partner is pulling away from me. So what do? I'm going to get louder. I'm going to show signs of distress. Just like if you've ever had the experience of a little kid getting separated from their parent, the first thing they'll do is scream bloody murder. They want to make sure that you hear me. I need you. Come back here. Stay connected with me. Don't leave me. Mm-hmm. And then there's another side to that, and that's the person who might be one who gets a little bit freaked out when they see a lot of activity like that. And they may decide that the best way for them to stay close and to stay connected is to really, I always call it the don't rock the boat people. Let's just be really calm. In fact, let's have less contact. Let's just batten down the hatches here and not do anything rash. Mm-hmm. And paradoxically, of course, that really triggers their partner, who's the pursuing person, to getting louder and more insistent and sometimes more critical and sometimes more blaming, and that makes the withdrawing person clam up more. And so what you see there, what EFT is about helping a couple really understand their particular pattern. Every couple is different, and even though I've just given you a general overview there, there are some very specific nuances to each couple. And so, for example, it's not useful for people to say, well, I've already been in EFT with my ex, so I now know what my part is in this relationship, because every relationship is new. So you have to learn about this particular couple, these particular people, and tailor the pattern help them see their own pattern very, very specifically. And once that's done, and they really get an idea of what that pattern's about, so they have this very explicit picture of their distress. And then what we work on is a very collaborative and respectful process. And I stress that because sometimes people come to therapy and they're afraid that they're going to get called on the carpet, they're going to get criticized, they're going to get told that there's something wrong with them by the therapist, and that really there's no place for that in EFT. EFT is about finding out what's right about you and helping you helping your partner decode some of your messages, because usually underneath the withdrawing and pulling away or the criticizing and blaming are some pretty positive messages, which are, I'm scared, I want to be closer to you. I'm scared, I don't want you to criticize me anymore, I'm going to pull away. And so the next thing that we do is that we start implementing some very targeted change strategies and interventions. So first we help the couple develop their map, and then we help them change their pattern.
It sounds like couples are pretty receptive to this as well once they get into it and they understand where you're going and where you're taking them.
Yes, most of the time people are really relieved, and I've had people say to me, oh, I'm so glad, I was so worried that you were going to tell me there was something wrong with me or that it was hopeless, and in the beginning, sometimes it's the therapist who's got to hold the hope for the couple and help them get to a point where they can see it too. And so sometimes when you're sitting in that third chair, you can see things, you can see strengths, or you could see people trying to reach out to each other, but then you can see their partner missing them. And so the job is just to help connect and say, let's look at that again. And one of the key parts of EFT is that we work very slowly and in a very gentle way. So that you have time to catch up with your feelings.
Well, Nicola, thank you for telling us a little bit more about the therapy known as EFT, emotion-focused therapy. And we appreciate you joining us today, and we'll be talking more about this topic in upcoming interviews soon.
Thank you.